I'm Dr. Chandra Jayasuriya, consultant ENT surgeon.
I'm Dr. Dinushka Dantanarayana, registrar in ENT.
Both of us are here today to show the parotid examination. Parotid examination is complicated. There are several components. We can miss some components if we don't do it methodically. So we are going to show each component using a patient with a recurrent parotid lump. Sanjeevani, මම ඩොක්ටර් චන්ද්‍ර ජයසූරිය. ඔයාගේ මේ ගෙඩිය අපි ටිකක් පරීක්ෂා කරන්නයි යන්නේ. මේක කොච්චර කල් වෙනවද? අවුරුද්දක් විතරයි. Before examining, we are going to clean our hands. In parotid examination, there are several components. We have to first examine the lump with all the dimensions, and then we have to examine the neck for lymphadenopathy, and we have to examine the ear canal to see whether there is any extension. We have to do the temporomandibular joint examination, and facial nerve examination also has to be done. In addition, we have to examine the patient's oral cavity to see whether there is any deep lobe enlargement. Parotid is located in between the mastoid process and the angle of the mandible. And this is a small parotid lump. If the parotid lump is bigger, this earlobe will be raised upward like this. There is a visible scar around the lump, and there is discoloration also over the lump. Now he's going to examine for the dimensions of the lump and the mobility, and whether there is any surface whether it's smooth and whether it is slightly sensitive, because when we examine the patient says it's slightly sensitive, and it is moving longitudinally and horizontally. And Dakmitikanna, when patient is clenching the teeth, their mobility is not restricted, so that means it's not attached to the muscles, and the edges of the lump are smooth, then it is firm in consistency. To examine the neck lymph node, we have to expose both clavicles. We are going to demonstrate examination of lymph nodes on right side. So the base of the posterior triangle is just above the clavicle, and now he is starting the examining the base of the posterior triangle, and along the anterior border of the trapezius he is palpating the posterior triangle lymph nodes, going behind and then examining the mastoid nodes, and go around the pinna, and then go and examine the preauricular nodes, preauricular lymph nodes. And now we have to go along the anterior border of the sternocleidomastoid to palpate for the deep cervical nodes. And then now we come to the middle and the suprasternal nodes, and now we follow the anterior border of the neck to examine the anterior nodes, and then submental nodes, submandibular nodes, and coming back to the parotid gland. So there are no obvious palpable lymph nodes. The next part of the examination is to examine the ear canal to see whether there is any extension of the tumor into the ear canal. ඔයාගේ කටේ ඇඟිලි තුනක් අතේ දාලා පෙන්නන්න. She can accommodate 3 fingers while opening the mouth. There is no trismus, so there is no restriction of mouth opening. And we can palpate the temporomandibular joint, hatarinda and mahanda. So she has no tenderness over the temporomandibular joint. So the joint is also not involved with this tumor. And the mouth opening muscles are not infiltrated, so there is no restriction of mouth opening. We are going to examine the facial nerve. To save time, we are going to ask the patient to imitate the doctor. The doctor is going to activate all the facial muscle groups, so we can see whether there are any paralyzed branches. Forehead is working, eyes are working, no power comparison, no palsy. ඇසැරලා බලන්න. Mouth opening is normal, angle of the mouth is okay, and the power of the buccinator is equal. Whistle කරනවා වගේ. Right, so all the facial nerve branches are intact in both sides. Parotid gland examination is not complete until we examine the oral cavity. So we have to examine the oral cavity for the parotid duct orifice and the displacement of the tonsil for deep lobe enlargement.
කට අරින්න.
Sir.
දිව දාන්න එළියට. කියලා සද්ද කරන්න. කියලා.
There is no displacement of the tonsils.
කට අරින්න. හොඳට කට අරින්න.
So he is palpating the parotid duct to check whether there are calculi or any abnormality in the duct, and then the palpation of the tonsillar bed for deep parotid lobe enlargement
දිව දාන්න.
by manual palpation, and there is no enlargement of the deep lobe.